Hello everyone, I am Dr. Somyaa, Consultant General and Minimal Access Surgery at Sakra World Hospital. Once you are in the pre-op resting area, the anesthetist will come and see you again, in spite of doing a pre-anesthetic evaluation one night prior. So during this checkup, again your fasting status is checked. Please do not get hassled if you are asked again and again as to what surgery you are undergoing. It's just a check being done again, and actually this check is done 4 times to ensure that the correct surgery for the correct patient at the correct site is being done. And we adhere to the WHO protocols, and we have this WHO checklist with which we ensure that the correct patient is undergoing the correct surgery. Now once you go into the OT, generally for gastrosurgery or hernia patients, we either ask the patient to void or we would have taken a decision to catheterize the patient. So if there is no catheterization, you will be asked to void for urine before going in for surgery. You may be walked into the surgery if you are if you're a young healthy person and you are comfortable to walk and you do not have any pain. If you have any pain, like if you have acute appendicitis or any other infection, you may be wheeled in a bed. Once you're inside the OT, we want you to be calm. The anesthetist is there with their calming presence. They give you some medications to ensure that you are comfortable, and slowly, steadily, you either go off to sleep as in general anesthesia, or you're given an injection in the back, which is spinal anesthesia. Before you wake up from the surgery, there will be some medications which will be given to you so that you don't wake up in pain. So you will be comfortable. And at this point of time, once the surgery is done, is when the surgeons will go and speak to your family and just explain as to what exactly happened during the surgery. Now again, the family needs to understand that you're not going to be meeting the patient again at this point of time. The patient still has to undergo a 2 hours or 3 hours of observation in the post-operative area, and post that only once we confirm that the patient is comfortable and pain-free, we can shift him or her to the ward. If the patient is going to the ICU, once the patient is settled in the ICU there with all the lines being settled, then maybe in half an hour or so, the family can be asked to come in and meet the patient.